Shift work in nursing, 8-hour versus 12-hour shifts. Did you know that only 26% of nurses work shifts of 8 hours while the remaining percentage of nurses work 12-hour shifts? Shift work in nursing is best defined as work hours that are scheduled outside of the daylight. Nurses are largely locked into schedules that provide 24-hour care. 24-hour and 7-day-a-week care is imperative for the patients to be monitored for their health and safety. When looking into shift work in nursing, there are several side effects that may occur, which include disruption of natural processes, circadian misalignment, disturbed sleep, and more. When talking about the impact on the nursing profession with the ethical issue of shift work in nursing, the risks of endangering nurses' health is a huge impact. Having insufficient sleep can cause some risks, including poor job performance, personal injuries, and even a wide range of diseases such as musculoskeletal disorders, gastrointestinal problems, gastric ulcers, diabetes mellitus, cardiovascular disease, and more. The impact on patient care from shift work in nursing can lead to poor patient care. This is because if there is non-attentiveness within fatigued nurses, patients may not receive the best care possible. Many errors could be made within the patient's health that can lead to poor outcomes. Moving forward with some organization views, the ANA stated that registered nurses should be discouraged from working extra shifts as well as working overtime because of its major cause of fatigue. The ANA also stated that every registered nurse, if asked, should be allowed to decline any overtime work without any penalties, as well as they address nurse fatigue to promote safety and health. Some of the views that the ANA pointed out was linked under some of their regulations, such as, by quote, in addition to its association with increased risk for errors and reduced job performance, fatigue has major implications on the health and safety of registered nurses. When looking at the CDC views, their guidelines state almost the same as ANA's views. They showed research that indicates that shift work in nursing increase health and safety risks by the disturbance of sleep and more. When looking into the advantages for 8-hour shift in nursing, there are a few that I have listed, which include being less fatigued, less burnouts, fewer errors, and fewer injuries. The advantages for 12-hour shift work include less patient turnover, better work-life balance, and a greater flexibility within the nurses. Following with the advantages, now let's look into some of the disadvantages. The disadvantages of 8-hour shift work in nursing include not having enough free time, more commuting, and a more difficult work-life balance. The disadvantages for 12-hour shift work include more fatigued, more burnouts, non-attentiveness, health issues, more job injuries, and more errors. A main ethical issue in shift work in nursing is the result of errors and poor outcomes from long hours such as 12-hour shifts. As a result from these concerns towards the demanding shift work schedules in nursing, new protective legislation is being advocated in the United States. An example would be to restrict the hours of work among nurses and other healthcare professionals. A few relevant ethical considerations involve mandatory or unpaid overtime, potential limits on voluntary assumption of risks, gender-based inequalities related to working hours, and employer responsibilities for protecting individuals who are not employees from the leftover effect of demanding work schedules. Overall, the topic on shift work in nursing can lead to many issues, following some positives that can come along with both shifts required. 12-hour shift work in nursing result in shorter work weeks, reduction in staffing needs, fatigue, stress, and affected health and well-being on most nurses. 8-hour shifts affect patient care for the better, less days off, more downtime, and patient satisfaction. The ANA and CDC both give their views on this issue, saying that working long hours results in fatigue and bad job performances. They both state the risk factors and health issues regarding this topic on nurses. Ethical issues involve poor patient satisfaction as well, leaving both the nurses and patients unhappy.